Welcome to the Sports Medicine Clinic. My name is Dr. Joshua Peiper, and today I'm going to demonstrate a self-myofascial release and muscle energy technique for the hamstrings. The hamstrings are hip extensors that are attached to the posterior or backside of the upper leg from the sit bone at the hip to the lower leg just below the knee. When these muscles are dysfunctional, they can cause pain and restricted motion when walking and running. For this technique, you're going to need a foam roller or a medicine ball about 6 to 8 pounds. Start by placing the foam roller beneath the upper leg just above the knee. Move the foam roller toward the hip, using it to identify tender spots or myofascial trigger points. Once you have identified trigger points, stop for 20 to 30 seconds or until the intensity of the discomfort decreases. Once this occurs, continue moving the foam roller toward the hip, identifying other trigger points. To achieve the ischemic compression component of this technique, we are going to identify trigger points and pin them down for 20 to 30 seconds or until the intensity of the discomfort decreases. To achieve the self-myofascial release component of this technique, we are going to identify and treat 3 to 4 trigger points, which will result in loading and unloading of the fascial structures for approximately 1 minute. For the muscle energy technique, we are going to use a seated hamstring stretch. Start by leaning out over the affected leg until you feel the first sign of resistance or the first barrier, and hold this position for approximately 10 seconds. Extend the hip and flex the knee, pushing the foot on the affected side into the floor with approximately 10 to 15% of your strength for approximately 5 seconds. Rest for 1 second before leaning forward until you feel the next sign of resistance or the next barrier. Hold this position for approximately 10 seconds. Repeat this process 3 to 4 times.